So how to know the order of the pulmonary artery branches? Okay, to detect the involved pulmonary artery branch in a case of lymphoma or embolism. So firstly, you need to know that the main pulmonary artery is not a branch, it's the main pulmonary artery. So it's not the first order pulmonary artery branch. Okay, so either the right or the left main pulmonary artery are not a branch. However, they give the lobar branches. The lobar branches. Okay, these lobar branches are the first order pulmonary artery branches. First order. These lobar branches give segmental branches. The segmental branches are the second order branches. These segmental branches give subsegmental branches. The subsegmental branches are the third order branches. So if you see a V-shaped branch within the inner third of the lung, this is the segmental branches or the first order or the second order branches. If you see a V-shaped branch, V-shaped branches, not within the inner third, within the middle third of the lung. So here this is within the middle third of the lung, not within the inner or the outer. So the V-shaped branches within the middle third of the lung are the subsegmental branches or the third order branches. So V-shaped within the inner third, this is segmental or second order branches. Here, V-shaped within the inner third, segmental branches or second order branches. This branch is within the middle third of the lung. So this branch is a subsegmental branch or third order branch. However, this one is seen within the inner third of the lung. So this branch is a segmental branch or second order branch. Can you see here this one? A V-shaped within the middle third. So this is the subsegmental branch. And this one is the segmental branch. Okay. The branches here, okay, are not enhancing. Okay, so they are not enhancing, indicating infiltration by the invasive mass. Okay, so here, this is the middle third of the lung, and these vessels are within the middle third of the lung, so they are the third order branches or the subsegmental branches. And they are non-enhancing, indicating occlusion or infiltration by the invasive mass. These vessels also are not enhancing, indicating infiltration by the invasive mass. Another one, in the middle third of the lung, this is a subsegmental or third order branch, not enhancing, indicating infiltration by the invasive mass. So let's talk about the lymphoma. Lymphoma sometimes show mass effect with displacement of the surrounding structures and the compression of the trachea and the left main stem bronchus. Here is also another example of the mass effect of the lymphoma with the stenosis or compression and stenosis of the left main stem bronchus. And lymphoma sometimes shows invasive criteria like invasion of the lung, as you can see here, invasion of the main blood